And we welcome now to the program David Culpepper, Marketing Director, Covington County Hospital. David, good to see you. Thanks for coming on.
Absolutely. Good to see you guys. Appreciate you guys being here.
So give us the latest. What's going on at Covington County Hospital? How are you guys doing these days?
We're good. The hospital's doing well. Like any other hospital or any other business, we could always use a little more bottom line to do some things and to reinvest back into the organization. But, all is well at this point. We've had some things take place in the past year or so that's helped out rural hospitals and hospitals in general with what the governor did last fall with the raise in Medicaid payment rates. And, our CEO, Greg Gibbs, is the type guy that he says, hey, glass half full, let's go fill it up. Let's go get after it.
So is the hospital producing a positive cash flow?
Yeah.
Okay.
EBITDA's there.
Okay.
Of course, you know that term.
Oh, yeah.
It's there. So we've got the opportunity to cash flow the business and put a little money back too. And, when we have some good months where we're in the black and,
Okay. That's actually a little unusual, as you well know, in the state of Mississippi.
It is. So
congratulations. Not many of the healthcare institutions at the hospital level are actually producing a net positive cash flow.
Yeah, and it's a struggle. It's a struggle, but it's something that you've got to pay attention to. You've got to put the people in the right places and streamline some services. And our CEO has been really good about doing that.
Yeah. Well, that's good. So, what did you think about the efforts by our legislature this year to expand Medicaid, which came to an end yesterday?
Wow. There's a lot there to digest. May need a couple of shows to digest that. Let me just say this, that the Medicaid, for hospitals, Medicaid's changed in the past year. Yeah. It has now become one of the best payer sources there is because they're now basically as a private source. So, prior to what Governor Reeves did back last fall, you would lose your shirt every time a Medicaid patient came in because you weren't reimbursed and at a level to cover your costs. So now that's changed. I guess the question, and I guess this is the question that came up with both the House and Senate is, how do we create more access to care that's cost effective for everybody involved? And that's a tricky question.
Yeah.
We can do some things, for us, we think you need to request a waiver from CMS, continue exchange enrollment.
Yep.
For those that are 100 to 138% of the federal poverty level. And that would allow you to do some things, but it also allows Mississippi to pay cost sharing for premiums, copays, and things like that. And that way you preserve and you don't break the exchange that's there. And there's some good pieces that come out of it. But, the biggest thing for hospitals with the change that the governor made is it allows you to recruit more physicians because now you're not just taking care of Medicaid patients, but you're taking care of Mississippians as a whole. And, there's some things that need to take place there. There's no simple stroke of the wand or simple answer to solve that equation with Medicaid expansion. Do we need to expand it? Yes. How? There's so many things that are there. Do you need, if you get more people on the roll, do you need more providers?
Yeah.
Because you got more people needing access. And, but I can tell you this, if there is an expansion and money trickles down, it allows smaller hospitals like ourselves to expand service lines or partner with other organizations and other clinics to bring specialized service lines into smaller communities to where otherwise they would have to drive 45 minutes or over an hour to get there.
Yeah.
To where now they can do that at home. So it's got some good things attached to it.
So in the income group of 100 to 138% of the federal poverty level, as you know, coverage is available to them, virtually free coverage, honestly, in the ACA exchanges. That's been around since 2014. It's estimated we have about 200,000 that would qualify for subsidized coverage in the exchanges. They just aren't signing up.
Right.
How do we get them to sign up?
They're supposed to be, if you don't have health insurance, you're supposed to be a tax penalty or some type of penalty when you file.
That went away.
That's gone away. It never followed through. So I don't know the answer to getting them on there. I mean, because it's basically free now, and that's kind of been the argument in the past has been it's already free. Why are they not taking advantage of it?
Totally agree.
Maybe you put some type of incentive that says if you take advantage of this, you get this. You get some type of incentive. I don't know the answer to that, but that's been an ongoing question, ongoing battle. Is it's already free or it's
close
reduced, subsidized. Why aren't people using it?
Yeah. So I believe there are 5 carriers now that sell plans in the exchanges. What about your hospital? Do you accept all of those?
We do, with the exception of one, and it's not that we don't necessarily accept it. It's that we're not in network, and that's Humana Gold. And that's not, but there's no critical access hospital that's in network with Humana Gold.
Okay.
So it's kind of a blanket policy for them across the board. So it's not a shot at them. It's just, and I get it. But if you do come into the hospital through the emergency room, you're going to be seen. You're going to be taken care of, and we're able to file that, and and they don't look at the in-network process for emergency care. But for routine care, things such as that, there's a prior approval and all that, and not in network. So.
Okay. Have you seen, David, that it seems like, to me at least, more hospitals and providers have begun to accept the coverage sold in the exchanges? That's actually improved, is it not?
It has. It has. You've seen more people become in network for the simple fact that first they didn't want to accept it, didn't want to accept the low reimbursement rate, but it kind of got to the point where, okay, it's out there, so, and more people are getting in the exchange and on that program, so you kind of got to take it if you want to get paid. Yeah, get paid anything, and it's and here's the thing: a lot of those exchanges, a lot of the phone calls, there's a lot of misinformation out there when that comes open enrollment in October. Yeah, is you get to a point to where you're getting a $500 gift card. Well, one that sounds like enticement, but that is what it is. The other side of it is that's $60 a month. Yeah. And what you're fixing to pay out of pocket is fixing to quadruple that for just average run-of-the-day health care. Yeah. So there's some misconceptions there that, I get this, I get that, yes, but your network's a lot smaller as far as the providers that you can go to. Yeah, and I've heard that complaint for a lot of people that have the coverage, and especially when it comes to care from specialists that generally don't take it. Might take Medicaid, but don't take some of the private coverage in the exchanges. Right. And that can be a problem. But it does seem like that network, those networks are growing. They are. And you've got providers that have just basically said, I've got X number of my patient base that's converted to this. And, and it's a battle after open enrollment in January every year anyway, because you got to fill out all the new paperwork when you go to the doctor, because everything's changed or could have changed. And it's, And for someone not presently carrying insurance, that kind of compressed open enrollment period is also a problem. It is. As well as that. Okay, well, I'd like to go sign up because I want to start seeking health care, but I got to wait for open enrollment, but I need to get treatment now. I need to get served now can be a problem. And health care is really the only business where you can go in, get treated, not pay a penny, walk out the door, and everything's good. You can't go to the local Ramey's grocery store here and pick up a pound of hamburger meat and say, hey, send me the bill on that. Totally agree. I've literally stood in a room with a bunch of business people and asked that rhetorical question: how many people in here are willing to provide their services even knowing that the customer can't pay it? Of course, nobody raises their hand. No. Hospitals do that every day in the ER. Every single day. And whether you have the ability to pay or you have coverage or not, you're still treated with the same care. And it's it's mind-boggling. You don't stop and ask them while they're having a stroke, hey, can you pay me if we treat you here? No, right? No, we're going to get you. Can't do it. Well, once they present, due to EMTALA laws, they're yours. Right, exactly. You can transfer them out for a higher level of care, but they're yours. I did a little research on them. What did we do before EMTALA? And best I could tell, we had a lot more county hospitals in the country back then. We still have a lot in the state of Mississippi, but virtually every county had it. And that's where they'd often get transferred. And the county just did whatever they could to kind of take care of them, make them comfortable, what have you. But it was substandard care because they wasn't getting paid. And they weren't getting paid, or if they were, it was pennies on the dollars. And I think that's where the MHAP fund kind of came into play later on down the line to kind of offset some of those expenses for what you're taking care of and not getting reimbursed for. But, I mean, it's – when someone's sick, it's just human nature to give them great care. Sure. And, it's one of those things, and we've won some awards for our overall hospital care and medical care at Covington County in the past year or so. And, we do a great job of taking care of those folks because in a small community like this, everybody knows everybody, or you're related somehow. You're either related by sitting next to you on the church pew, or we're, my ex-sister-in-law from 2 marriages ago. Somebody's related to somebody. somewhere. So, your care becomes personal.
We got about a minute left, but I just wanted to run this by you. What about your staffing? Are you in good shape there? I mean, I know you guys are always looking for people, right?
Yes, we're always looking for good people, but, fortunately, even through the pandemic, we were able to hold on and not use a lot of travel personnel, and we were able to keep our people and pay them, take care of them, keep them happy, and that means a lot.
Have you seen compensation increase to be competitive in the market?
Oh, yeah. You've got to.
Yeah.
Because if not, you lose good folks. But we've been very fortunate that we've had people hang on.
Got it. David, enjoyed talking to you. Appreciate you coming on.
Absolutely. Appreciate it.
Enjoyed it. David Culpepper, Marketing Director, Covington County Hospital, has been our guest. We're in the Element Well studio today in Collins, Mississippi for the Okatoma River Festival. Stay with us. We're coming right back.